Hello. Okay, so in this screencast, I'm going to look at a portion of development for our 0 to 2 babies. We're going to look at some of the senses. This isn't a big area, but we're going to look at this. So first of all, think about it. All sensory areas in the brain are online, the sensory cortexes and so forth, visual, auditory, all these things are online. And so they have been developed in an experience expectant kind of way. The brain has the regions and the capacity for sights and sounds and smells and touches, but it's going to rely upon experience to strengthen those and really build them and help them differentiate. So if we think about it, baby is already learning when in the womb, and which sense probably gets the most use with having to be worked the hardest. So I'll just tell you, hearing. Baby can hear things, can hear things that are going on up close and personal inside of mom, and heartbeat, digestion, all that kind of stuff. Also, mom's voice resonates through baby's body, resonates through her body to baby. Babies can recognize their mother's voices, pick them out, show their preference for them from pretty much the get-go. And because they're familiar, they have heard them for a long time. And so now so they, it's very much functioning. The least mature, the one that's not going to work very well, is think about it like vision. So, baby is in a tight space by the time they're done and fairly dark. There might be light changes, gray to, dark, but nothing really to allow them to use their visual cortex very much, to get experience with it. So vision is the least mature at birth. Newborns can't focus very far, 4 to 30 inches. Binocular vision, the ability to use both eyes to coordinate looking at one image, doesn't really, they just don't get it coordinated until they get enough practice. So it takes till about 14 weeks. So think about it, tasting is another one that baby gets to use in the womb. They get very used to what mom eats. They get the flavors that mom eats, which introduces them to the culture and to mom's preferences. And they can show their preferences based on those things and their knowledge of different tastes when they come out. So all these things are functioning. Baby can recognize a person's smell at the handling pretty quickly. So the more experience they have, everything is online for experience expectant, but the experiences, they are experience dependent and how they get shaped and formed. Now, touch and movement is the one I want to spend a little bit of time on. The somatosensory cortex controls processes of information concerning touch and pressure on the skin. So it actually is like a map of the whole body. And it has bigger areas for areas that are more touched and do touching, and so it's more sensitive to touch. Bigger areas in this mapping, and so it activates and coordinates and integrates all of that input. Motor cortex controls the body movement. So the baby, upon birth, the baby hasn't been able to be touched, right, until they're born, except by the little walls in the womb. And so as they get those experiences, these parts of the brain just activating and growing, and connecting up. So this is off text. This isn't in the text. Dr. James Prescott did some study. I just find this interesting. There will be a video that you can stop and watch when we get there, or you can watch when I'm done with this section. That's pretty interesting about this. But here's just some things from him. So he says somesthetic processes, that's body touch. Somesthetic processes is body touch, and vestibular cerebellar processes. So that's the movement and from the cerebellum, movement, balance, coordination. That's body movement. So body touch and body movement are two critical emotional senses that define the sensory foundation for the maternal-infant bonding. Now, we don't think about this. Of course, we think about touch being important, but what's this with the vestibular, this body movement? So it goes on to say that sensory deprivation in the other sensory systems, vision, hearing, smell, taste, do not result in maternal social deprivation, and or kind of sensory disorders. Monkeys showed rocking and repetitive behaviors, depression and aggression toward other monkeys, and an aversion to touch when they didn't get this body touch and body movement experiences. So if we think about it for children when they're in the womb, they don't get the touch, but they get the movement. It's kind of a foundational sense for them. They are moved around with moms, walking and moving and exercising, and whatever she does, they feel this side of rocking. And so if we think about it, when babies come out of the womb room, what do we buy them? We buy them bouncy chairs, and we buy them swingy chairs, and we put them in little swings, and we bounce them to get them to sleep, because this is something that they have experienced from the very, very beginning. And so these particular parts of the brain have been wiring up from the start of brain development. So brain studies, monkeys reared in isolation without any maternal care. I know this is so sad. And we look at some of these, and this is part of the video, and it's sad. And this is how, have a love-hate relationship with this, right? You hate to see it, but this is how we've learned about human needs for children. So monkeys reared without any kind of maternal care showed structural and functional brain abnormalities in the limbic, so that emotional centers, frontal for thinking, and cerebellar system. So the integration of all of these, they don't integrate well, right? So theorized to be responsible for depression and violence in these monkeys, because they saw that these monkeys were depressed. They would rock. They would stay isolated. They didn't want to be touched. When they were put with other monkeys, they could become violent. Now Mason and Berkson, back in the 60s and 70s, did some studies with this. They isolated infant monkeys, but they gave some monkeys a swinging mother surrogate. So it was just like a big jug wrapped in fur, but it was on a swing. So it could swing around. The monkey could swing. And it promoted that vestibular cerebellar stimulation, prevented the development. They saw that these monkeys didn't develop these classical maternal social SAD syndrome, this sort of lack of attachment and bonding, these violent and rocking behaviors. Monkeys that were given a very similar, they were given the jug that was wrapped in fur, but it didn't move. It was just static. Had these, they would rock. They would rock themselves, and they would be depressed and withdrawn. And anyway, if you watch this video, I do have it on here. Go to brief introduction and click preview on the right, and you can watch from 2028 to the end. You can watch the whole thing, but we may watch some of it later. But this part of it, 2028 to the end, talks about shows. We see Dr. Prescott talking about and showing some of these studies, and they're really interesting. So the idea is that this system is primary neuropsychological foundation for trust in a baby, getting this continued rocking, being able to grow this motion, that it's experience expectant. And they actually get it, and so they continue to want it, and it's part of that maternal bond. So he goes on to even say that things like some aesthetic, so touch is the foundation for affection, and smell the foundation for intimacy. And so normal development equals a pattern of complex sensory stimulation, so getting all of these things, and development of an integrated brain of trust, affection, and intimacy form sort of a gestalt that we call love. So babies learn that this idea of love comes from all of these sensory experiences of trust, affection, and intimacy, touch, movement, and smell, being close, bringing out all of those kinds of hormones and things. long before the infant can understand the spoken or written word. That they are implicit. They become implicitly encoded in their system. So I just thought that this information, especially about the vestibular system, was really interesting and important. So that's all I got on that, guys. Bye.